Good team. So we're going to look at the second part of the connective tissue recorded lectures, which is looking at bones and joints, which are a type of connective tissue. Think about the different structures of connective tissue. We have cells and extracellular matrix. In terms of bones, it's the osteoblasts and osteoclasts and osteocytes, which make up those cells of that extracellular matrix. And obviously, it's a hard type of tissue. So you think about some of the functions of bones, provide us with structure, allow us a framework for movement, but also storage of minerals, so calcium, phosphate, and also production of blood cells, so our white blood cells and our red blood cells, bone marrow. So really, really important function. Different shapes. So I think of if you just go through the different bones that you know, so we've got long bones, which are longer than they are wide. Then we have the short bones, which are like a similar length and width and height. So bones like your carpals and your tarsals. Then we've got flat bones, which provide a big surface area, which allow a good attachment sites for muscles. So if you think about your scapula, super flat and wide, and there's lots of muscles that originate on that attachment, and then that flatness provides a really good space for that, but also for protection. And then we've got irregular, which are pretty much anything that doesn't fit into long, short, or flat. Your vertebrae and the spine are all irregular bones. And then we have the kneecap, which is the I always forget the name of this one, and it starts with the S. So I'll let you look that one up. Sinusoid or something. I always forget it. It's sort of like its own classification. Here's a picture of those different shapes. Long bone, it looks like a femur. There's the patella, which is that sinusoid classification that I can't quite remember if that's exactly the name. Then we have the short bones in the middle, which look like the classic knuckle bone game. So the length and width is the same. Irregular bones of the vertebrae, and then your sternum, which is an example of flat bone. Bone composition. 10% of bone is made up of the cells, so osteoblasts, cytes, and clasts. Another 10% is made up of organic material, which is collagen, which gives bone a slight amount of tensile strength. But it also traps ... calcium, so it gives a space for that calcium to be trapped. And then 60% is inorganic material, mostly calcium phosphate minerals and salts, and gives bones its rigidity, so that rigid, hard kind of texture. And then the last 20% is water. So water really does infiltrate a lot, or a big chunk of the body. This just shows you a structural design of how bone is. You don't have to remember this diagram, but you'll see that there's like these cylinders that have another cylinder, smaller, 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 and within those cylinders, the fibers of these structures run at different angles, so that bone is structured in a way that resists torsion, so twisting and compression and like flexing. That structure provides its strength. You'll also see you've got some blood vessels, arteries, veins, and some lymph vessels flowing through there as well. That diagram on the right is again just to show that structure of those cylinders is what provides bone with strength in multiple directions. Alright, so when bones come together, they create articulations, or when they articulate, they create joints, and joints allow movement. And this movement is created by our myofascial unit. So if we break that word down, myo means muscle, fascial means the connective tissue of muscle, units meaning those two tissues coming together, pulling on one or both ends of a joint. And then when those muscles contract, that myofascial unit contracts, it's going to pull, and there needs to be something in the middle that can create movement. Unrestricted articulation, so if there's nothing surrounding those articulations, they're vulnerable to injury. So ligaments, which is connective fascia connecting bone to bone, and joint capsules limit movement. So yes, joints provide movement, but other structures are in place to limit movement where we don't want it. So joints have other roles too. So joints are in place to bear weight. So if you think about your spinal joints, they absorb shock by using fluid as a cushion. And a balance must be struck between how much movement a joint has, but also how much stability a joint has. And that can depend on lots of different things, but often things like the structure of the joint, the nature of the structure of the joint, and things like injury, overuse, condition of muscle units, that kind of stuff. Here's just a breakdown of the different categories of joints. We've got fibrous, no synovial cavity, quite a dense, irregular connective tissue, and has little to no movement. So good connecting type joints. So things like the panels of your skull are bound together by fibrous suture joints. Your teeth are held in place by fibrous joints. Cartilaginous joints also have no synovial cavity. It's a type of hyaline cartilage or fibrocartilage, little or no movement. So things like the ends of bones are covered in cartilage with a disc of fibrocartilage that connects bones together. So if you think about like the space between your vertebrae, your pelvis comes together, you have that pubis symphysis. It's a cartilaginous joint that keeps those bones together. The intervertebral discs between your spine are cartilaginous joints. And then our main movable joints are our synovial joints, which have a cavity, so a space between articulations. There's this articular cartilage, so a space where hyaline cartilage covers surface area of bones to allow free movement. And then you have ligaments that hold bones together. These synovial joints are freely movable, whereas the other two are not so much. Components of the synovial joints, as I mentioned, you'll have this articular cartilage, which is hyaline. The idea behind this is to reduce friction when bone surfaces move across one another. Firm, translucent cartilage found on joint surfaces, no nerves or blood vessels. So if you don't have blood supply, repair is pretty tough. You've got nerves within these synovial joints. There's a membrane, so the internal layer of the joint capsule, which secretes a synovial fluid, which is this lubricating kind of oily fluid, which helps again reduce friction because we got movement. You've got the synovial joint cavity, so that's the space around the joint, holds the synovial fluid. Then you have the capsule, which envelopes the whole joint space. It's comprised of this dense fibrous connective tissue. So a pretty well-structured kind of joint, allows movement, but also provides stability and limits friction. Some other structures within some synovial joints, so we've got our ligaments, which provide stability around that joint, connects bone to bone. We've got these fat pads, which help thicken joint capsules and reduce the quantity of synovial fluid needed. So they're sort of like space fillers. Meniscus, this picture on the bottom left, we're looking down on a knee, so it's tough, it's this rubbery cartilage, and it provides some shock absorption properties. So if we think about a knee, walking, running, jumping, there's compression happening there. So that articular cartilage is not designed to withstand compression, so we have meniscus. And often meniscus structures can be torn during like knee injuries. Labrum is something that can enhance the amount of surface area available to increase stability or integrity within a joint. So this picture is showing that little wrist. It looks like a squid ring that surrounds the glenohumeral joint. The glenoid cavity of the scapula is pretty shallow, so this labrum can help provide a little bit more surface area to allow a little bit more movement at that shoulder joint. Bursa are like pillows full of synovial fluid, and they're positioned in a joint between moving structures to reduce friction and absorb force. So quite often they're found between a tendon and a bone. If you think about tendons and bones rubbing together, not ideal, lots of friction, reduced heat, damage. Bursa is there to try and prevent that friction, reduce wear and tear. And now the key with understanding synovial joint types is understanding the types of movement that they provide. And this is quite important because it can help you understand joint actions and describing joint movement. Hinge movements, just like a door, you've got flexion and extension only, and often outside of that movement of a hinge joint, you start to describe injury. So this example is showing the elbow with the humerus and the ulna. So the humerus and the ulna is the big articulation that creates the hinge joint. On the right, we've got a pivot joint showing I think it's the atlas, which is like the top bone of the neck that can pivot your head. The other one that's quite important is a pivot joint is actually the one on the left between the proximal end of the radius and the ulna, which can actually sort of sit like this and can pivot to create pronation and supination at the elbow. So that's actually the articulation between your radius and your ulna at both the proximal and distal ends. That gives you pronation supination. So that's a pivot joint example as well. Ellipsoid, sometimes also called condylar. I've always thought of it as condylar joint, but it's sort of like your hand in an egg. It allows similar movements to a ball and socket, and what it doesn't allow is rotation. So the example here is the wrist joint between the radius and your carpals. You can flex, extend laterally, but you cannot rotate, so you don't have rotation. So that's sort of the biggest difference between an ellipsoid and a ball and socket. Saddle was the example of the shape, I guess, is a horse saddle and a rider. It allows movements like this and like this, and it's specific to our thumb. And what I understand is that it allows us to do this. So I think this joint action is actually called opposition, and it is something that monkeys don't have that ability. They don't have a saddle joint in their fingers, so they can only do this. They can't do fine motor skills with their fingers and thumb. Ball and socket, like the condyloid or ellipsoid, except you can get rotation. So big ball and socket joints are our shoulder and our femur and our acetabulum or our pelvis. So your flexion, extension, abduction, adduction, internal, external rotation. The most movable joint that we have. The problem with heaps of movement is then that's when stability becomes an issue. And then we have gliding joints, which are flatter surfaces coming together, but they can move. So the example here is your tarsals and your carpals. So in between your tarsals and your carpals, you can get a bit of movement, which are gliding joints. So some clinical applications, you will actually know more about this than me in terms of feel as a massage therapist. But active range of motion is physiological movement that a person can actively produce at an articulation. So that's getting your clients to go into full extension themselves, compared to passive range of motion, which is manual positioning of a person. And then accessory movement is the amount of movement that can occur at a joint, but is not reliant on voluntary control. So somebody else pushing and pulling at the knee joint when it's flexed to see how much accessory movement is there. And it's often used to test like how much is normal movement and how much is excess. If you've got excess movement in a relaxed state, then you're probably looking at some kind of damage to those ligament structures. Here's a little infographic which shows sort of what your active range of motion is. There should be a little bit extra passive range of motion. There should be a little bit of accessory movement, and then outside of that is when there is injury, dislocation. So we're outside of that normal range. So understanding what accessory movement feels like, normal accessory movement feels like for an individual is really important. Also the difference between, like, if active and passive range of motion is the same, then something's up. If there's a big difference between active range of motion and passive range of motion, again, something's up. So understanding norms can help you, and that can be individual for people, can help you understand what areas you need to work on. Hypermobility, hyper meaning excess, so excess joint motion. Hypo meaning low, generally due to like constraints in joint mobility. Sometimes structurally and genetically people have limited joint mobility, but then other times it's through injury, prolonged inactivity. Pregnancy increases hormones that prolactin or laxin, I think it is a hormone that increases laxicity in joints, hypermobility. There's various reasons for both of these things. Infeel is when you passively mobilize a client's joint to its normal barrier, and you'll have a feeling of what that infeel is like. So normal infeels are bony infeels, when bones make contact hard, soft tissue approximation. Think of this as your biceps getting in the way of your elbow flexion when you're showing off your guns, like physical structure of those muscles getting in the way. Soft elastic sensation made by tension of muscle tissue. So like antagonist muscles are resisting end range through their own limit and stretch, and then ligaments yielding some like restrictions because that's their job. Then we have these 5 pathological infeels, so stuff that's not normal, so injury, breakdown, hypermobility. So muscle guarding stops early and abruptly, rebounds from hyperactive muscles. So muscles that are like contracting against passive range of motion, usually due to injury. Capsula, reduced range of motion, and missing the usual slight give, often associated with sticky capsulitis, so adhesive meaning like gluey. Boggy or soft or spongy. Excess swelling, so if you've got an injured joint that's got excess fluid within that space, it'll feel boggy, and I think of that as like trying to walk through mud. Spring block usually occurs at joints that contain meniscus or articular discs. That's because damage of these discs create like this locking block, and it'll cause joints to rebound from that space. Meniscus tears in knees can often have like this clicking or lock space, and then empty movement stops due to pain rather than mechanical barrier. So that might be something like acute bursitis. So bursitis meaning inflammation of the bursa. So you don't get to end range because of pain. Strains and sprains, different injuries within joints. A strain is an injury involving stretching or tearing of a muscle or tendon, so the musculotendinous unit. Can be caused by a direct blow or overstretching or overuse. And then a sprain is more commonly referred to a stretch or tear of non-contractile tissues, so things like ligaments. How I remember this is I always used to sprain my ankles, and that was always a ligament thing. So sprains are ligaments, strains are muscles or tendons.